Ayurvedic Management of Alcohol Use Disorder. This is printed in the Journal of Ayurveda and Integrated Medical Sciences. November 2023. Abstract. Substance use disorders are chronic, relapsing disorders leading to significant impairment in psychosocial functioning. Nicotine and alcohol are the most widely consumed psychotropic drugs worldwide. The common use of both increases the non-communicable diseases to many folds. Conventional therapies have not been able to alter the outcome of these disorders significantly, and frequent relapses continue to occur. Hence, there is a need to look at complementary and alternative systems of medicine. Ayurveda remains one of the most ancient and yet living traditions practiced widely in India and has sound philosophical and experiential basis. The planning of an effective, adequate management of alcohol use disorder in Ayurveda with the aid of Ahara, Vihara, Achara, and Aushadhi depends upon the strength of the disease and the stamina of the patient. Here is an attempt made to explain a case study of alcohol use disorder with holistic Ayurvedic management. Introduction. A drug is defined by the WHO as any substance that, when taken into the living organism, may modify one or more of its functions. The words drug addiction and drug addict were dropped from scientific use due to their derogatory connotation. Instead, drug abuse, drug dependence, harmful use, misuse, and psychoactive substance use disorders are the terms used in the current nomenclature. A psychiatric drug is one that is capable of altering the mental functioning. Alcohol is one such psychoactive drug, which is consumed all over the world, but the habit of being dependent on alcohol for coping with any emotions, trauma, depression, or any reason is where the addiction part takes birth. When one is involved in alcohol use, it's not just health that is at stake. It also brings out numerous mental and social impacts, from weight gain to liver dysfunction, to aggressive behavior at home, loss of income, unemployment, and harm to the unborn baby. Understanding alcohol addiction and looking for accessible, natural treatments are instrumental ways of lessening the impact of alcohol on a person. Alcohol addiction, also known as alcoholism or alcohol abuse. In Ayurveda, alcohol addiction is called manasikam visakwa madhyapash madhisaki sakti. A diagnosed case of alcohol use disorder was managed with an Ayurvedic treatment protocol using Snahapana, Virchana Basti, and Nasai, etc. Aims and objectives. A case study of Ayurvedic management of alcohol use disorder. Age 35, gender male, occupation unemployed, social economic status upper middle class. Chief complaints. Patients came in complaining of tremors in both the hands and disturbed sleep since past 3 to 4 months. History of present illness. 35-year-old male patient who is an alcoholic since past 20 years, complains of tremors in both the hands and disturbed sleep since the past 3 to 4 months. He started consuming alcohol due to peer pressure in college. He tried to quit alcohol in 2013 and was able to do it for 2 years but relapsed. And he also has a habit of chewing tobacco since 20 years. The patient is seeking help to quit these habits, so he came to our hospital for treatment. History of past illness, nothing significant. Family history, all are said to be healthy. No history of alcoholism in the family. Premorbid personality, introverted, sedentary, despondent, self-centered, lack of acceptance of responsibility, marital status, married. Treatment protocol. Aragrahini Rasa 222, the Kumarasava 50 milliliters with 30 milliliters of water, Brahmi, Sirapicho with Brahmi Tala, Amalaki Takrahara. The above medicines were given for 7 days. The second set, Vishinahapa with Adukartha Grita for 6 days, Savranga Abhyanga with Shirabala Tala and Bashpasveda for 4 days, Virachana with Laha with warm milk, Samajana Karma for 5 days. On the 6th day, Raja Vapanabhasti with Brahmi Tala, procedures, deep relaxation and meditation, and Aloma Viloma Pranayama. Advanced discharge medicine, Brahmi Vada for 30 days, Aranjavasa for 30 days, Saraswashita with gold for 30 days. First follow-up, Saravanga Abhyanga with Chirshala Patali, Shatika Shali Pindo Sveda, Nasai, Brahmivadi, Ariga Ardina, Saraswati with gold, Avran Pikara Shurna with milk. The above medicines were given for 10 days. Advanced discharge medicine, Arajavadi Rasi for 30 days, Saraswati for gold for 30 days, Ashwagandha Rasiana capsules for 30 days. Second follow-up, Saravanga Kakaseka for 7 days, Matabasti with Kalayanka Grita for 7 days, Sarashachita with gold for 7 days. Advanced discharge medicine, Shiva Kita with milk for 3 months. Third follow-up, Nitya Chana with Avipakara Churna with more milk for 5 days. Advartana with Tripala Churna for 5 days. Bashpa Sweta for 5 days. Advanced discharge medicine, Mente 101 for 15 days, and the Chitrakata Vadi for 15 days. Discussion. According to Ayurveda, the properties of alcohol are opposite to ujas, or comparable to poison. The only difference is that alcohol is less powerful than poison, so it doesn't kill the person immediately. Alcohol infiltrates deeply into the tissues, dhatus. It is dry and causes drying and harshness. It spreads throughout the body and is hot in potency. Alcohol loosens bone joints, dries ojas and causes mental disorders. Procedures. Virachana. Drugs capable of inducing Virachana possess Ashna, Tikshna, Sukshma, Virvi, and Vikasi properties. The Ushna property may help in increasing the quantum of Agni. It can cause Vishinadana of the dosha and the kashta, from where they can readily be expelled out. Due to Trikshna property, drug is able to disintegrate the saghati of dosha. Due to the Vayu property, such a medicine is able to spread in the whole body prior to its digestion. By virtue of its Vikasi property, the drug is able to compel the doshas to come out of the dhatus. Virachana drug possessing the above properties reaches the Hirata by virtue of its vira, and then following the dhamani, it pervades the whole body through the shrutula and shushkama srotas, causing Harada Shroti. Raja Vapani Basti. Vapani Bastis are important sets of Basti mentioned in the Charaka Samati Sita Svavana. The Basti, which sustains, support, and maintain life and promotes longevity, is called as Vapana Basti. As the name suggests, Raja Vapana Basti is superior among the Bastis. It performs dual function of both Anavasana and Dharana. Thus, these Bastis are Srota, Durka, and Brahma at the time. It is the best Rasayana Basti, and it also is indicated in Unmada, etc. Nasai. According to Charaka Samhita, drug administered through the nose enters the Uttamanga and eliminates morbid doshas residing there. According to Achara Vakbhada, drugs administered through the nose reaches Shrinktada Marma of Shriyas, which is the Siya Marma, and formed by the siras of the Nasa, Neta, Kanta, and Shrotra. Thus we can say the drug administered through Nasai may enter the siras above and purifies them. The adjacent nerve, called terminal nerves, which run along the olfactory system, are connected with the limbic system of the brain, including the hypothalamus. This limbic system is connected with the behavioral aspect of human beings. Thus, certain drugs administered through the nose may have an impact on immediate psychological functions by acting on the limbic system through olfactory nerves. This treatment opens mental channels and restores function, concentration, and awareness. With long-term use, it can also enhance memory. Tekrahara. Tekrahara with Jata Mansi aids in Rakta Tavata, Andra, Avasada, Vatapitta disorders, Oja Shakri, and Smiti Nasha. Udvatana is a Paripamita Chikitsa, which is performed in Patla Magadi as Baha Rakshana Karma, causes liquefaction of kapha and meta, promotes the metabolism. Mode of action of drugs. Saraswasita is one of the best Rasayana drugs. It's good for people of all ages groups. It improves immunity and strength. Saraswasita has shown proven effects in the treatment and management of neurological illnesses and disorders. An in vitro study showed that it enhanced the memory of mice treated with scopolamine while performing better than piracetam, a commercial drug for neuroprotection. In another study, when albino mice were pre-treated with Saraswati for 2 weeks, they gained protection against the memory and learning impairments of diazepam. The above-mentioned examples of experimental research on Saraswati effects in mice show that it imparts neuroprotective properties. Ashwagandha. Root and leaf extracts of ashwagandha exhibited noteworthy anti-stress and anti-anxiety activity in animal studies and human studies. It may alleviate these conditions predominantly through modulation of the hypothalamic, pituitary, adrenal, and sympathetic adrenal medullary axis, as well as through the GABAergic and serotonergic pathways. Ashwagandha is a real potent regenerative tonic, a rasayana of Ayurveda, due to its multiple pharmacological actions like anti-stress, neuroprotective, anti-tumor, anti-arthritic, analgesic, and anti-inflammatory, etc. It's useful for different types of diseases like Parkinson's, dementia, memory loss, stress-induced diseases, malignancy, and others. Brahmivati balances Vata and Pitta doshas. According to Ayurveda, Sarasanga Brahmivata is useful for the treatment of the mental fatigue, weak memory, tremors, depression, psychotic condition, and insomnia. Aragavahini Rasa is one of the most widely practicing Ayurvedic herbal-mineral formulations in liver disorders. It is Vakrit Prasadana and is helpful in Pachana of Amesvisha and corrects the formation of vitiated dosha. It has been used for the management of diverse types of Jara, Kashta, Madaroga, and other Vikrit Vikara.